We're going to talk now a little bit about fetal growth and maturity and a couple of concepts that might come up on the exam. The concept of the small for gestational age baby or intrauterine growth retardation. There are a lot of factors that can influence the growth of the fetus. The fetus is exposed to all kinds of products throughout the gestation, and so therefore that can affect the end product of the baby. We try to break it up into two types of intrauterine growth retardation. We try to call it symmetric and asymmetric. Asymmetric means that the head is spared. That's a good thing. That means that the brain is growing. Okay? As opposed to symmetric, symmetric means that the whole body has been deprived of nutrition or oxygen. And then if it's symmetric, that means the head has not been growing and neither has the body, and that means the brain has not been growing, and that's not as good an outcome. The onset of symmetric, as you see there, is earlier in utero, whereas asymmetric, the head has already grown, the brain has already done some growth later in onset. And you have a listing there of some of the things that may cause each one. And we put that table there so you can start thinking along those lines when they describe a baby. So that with the symmetric, you think of syndromes, genetic problems, chromosomal problems, or the torch infections, which we'll discuss in a little while. The asymmetric, you worry about anything that causes less oxygen going to the brain, or I'm sorry, to the body, or less nutrition, what we call utero-placental insufficiency. That was the UP stands for utero-placental insufficiency. Things like smoking, things like maternal malnutrition, maternal hypertension, all these things will affect the growing fetus. Another concept that we have is the Ballard scoring system for gestational age. You do not need to know the Ballard table. It's there, but you don't need to really know it. What it does tell you is that we have a way of estimating gestational age. We have the finished product. You know, OBs look at last menstrual period, look at biparietal diameter, look at the femur length, they look at all these things to say what the gestational age is. We have the finished product. We can do a physical exam, and we can say this baby is so many weeks. Once we know the gestational age of the baby, we will plot the height, the weight, and the length, and then we can decide if that baby is appropriate for gestational age. And it's all in charts. You don't have to know that for the exam, you just need to know the concept. A baby can be a preterm baby and still be appropriate for gestational age as far as its weight and its height and its length. A baby can be term and be small for gestational age or large for gestational age. So that's why we call it for gestational age. And we use the Ballard scoring system to help us along. Some of the things that we look at with the Ballard scoring system, it helps with the physical exam, are things such as the square window, and basically these are things that help us to see the muscle tone of the baby. As the baby gets closer to term, the baby gets better muscle tone. So we look at the square window, the popliteal angle, which is the angle of the back of the knee, the heel to ear. These babies that are preterm tend to be much more flexible, and so we'll have different angles. And the scarf sign is when we take the arm and move it across the chest. The more preterm the baby, the farther around it'll go. This is a small for gestational age baby. So this baby could be term, just light. It means it didn't get the appropriate calories. In this particular case, the head is disproportionately large for the body, so this is asymmetric. That's a good thing. That means that the brain has been growing. Other things that you can see as far as whether this baby is, the gestational age is going to be the baby's muscle tone. You can see that the arms are flexed, the legs are flexed at the hips and at the knees, the scrotum is well developed, just by looking at this picture. So you would say this baby might be this gestation, whatever gestational age, then you would plot it and you would say this one is small for gestational age. That means that it's light for whatever gestational age it is. Doesn't matter whether it's preterm, term, or post-term. That's the concept you have to know. It's small for whatever gestational age has been calculated. And now you have to start thinking, is it symmetric, asymmetric, what caused it? Large for gestational age babies, again, doesn't matter what the gestational age is. If it's a preterm baby, it can still be big for that age. But typically we'll see big babies that are term, and that's the large for gestational age baby, or we'll call it macrosomic infants. In particular, this is a baby that's greater than 4,500 grams. Babies at risk for becoming macrosomic are babies that maternal obesity or infants of diabetic mothers. They tend to be big also. Complications of large babies are going to be birth injuries. We already talked about the baby that has the clavicular fracture, and those tend to be big. We also, babies that are big, depending on what caused them to be big, may have congenital anomalies. A post-term infant is an infant that is greater than 42 weeks gestational age. These babies, on physical exam, you're going to see many times that the skin is already peeling off. Most babies start to peel skin around 2 weeks after they've been born. Well, these babies start peeling in utero. You may also see long fingernails. These babies are actually at higher risk for mortality and also at higher risk for meconium and meconium aspiration, which we'll talk about in a little while when we talk about respiratory problems. This is a preterm baby. This is a preterm by definition is a gestational age less than 37 weeks. Many preterm babies will also have low birth weights, less than 2,500 grams. Complications of preterm babies include immature lungs, which can lead to respiratory distress syndrome. Premature babies are at higher risk for infections. Premature babies are at higher risk for temperature instability, for having hypoglycemia, lots of different problems with preterm babies. Some of the things that we see on physical exam is the skin, for example, has a lot less subcutaneous fat. And these babies also are at risk for having hypothermia because they don't have that fat to protect them. So the skin tends to be quite thin. You can see visible veins very easily underneath the skin because of there's lack of fat. Also on exam, you can see the foot, that there's few creases. Usually the sole of the foot in a preterm baby is very smooth. Also the ears tend to be less cartilaginous and they don't flip or back and forth as much, and when you kind of bend the ear it doesn't snap back as easily. And another thing that you can see on this picture is the lanugo, and that's that little baby peach fuzz that you see. Babies that are preterm tend to have more lanugo. As they get closer to term, they start to lose that peach fuzz and have less and less of it. So that's another characteristic that we use to estimate gestational age. And here's a preterm baby, obviously in an incubator, with a hat, with clothes, because they're of high risk for temperature instabilities.